Member from Middlesex London.
Speaker, my question is for the Minister of Health and Long-Term Care. Minister, on October 1st, the Ministry will slash another $235 million from physician services at a time when Ontario's population is growing and struggling to find a doctor, at a time when our ageing population requires more help, more time with frontline services and more complex care. Minister, you're turning your back on doctors and the patients they care for. How can you continue to insist you're fully funding health care when you continue to make cuts to doctors, nurses and pharmacists?
Well, thank you, Mr. Speaker, and I appreciate the first question coming from my new PC party health critic. I welcome the questions. I welcome the ones to come. And I think the member opposite knows, because he's from the health sector himself, that we negotiated with our doctors for more than a year, and we used a framework, in fact, for those negotiations that was agreed to by both parties. We brought in a facilitator, Dr. David Naylor, to try and bring the two parties together. We brought in retired Judge Warren Winkler as a conciliator to try to reach an agreement, and in fact it was Warren Winkler's recommendation to the government and to the OMA that the OMA accept the government's reasonable offer. Unfortunately, the OMA decided not to accept that offer, and as the framework that both parties had agreed to provides for, we continued to implement that framework and made the changes that Warren Winkler had actually recommended to both parties.
Thank you. Supplementary.
Thanks, Speaker. Back to the Minister. Minister, you're asking doctors to foot the bill for medical care your government should be covering. We know you tried to hide the $54 million cut in the health care budget. The deal you forced on Ontario's doctors is restricting access to care for those in need. Doctors know how much their patients need them, and you aren't allowing them to do their job. These cuts will impact care in the future, as doctors will retire or leave the province instead of continuing to work in Ontario. Minister, how can you justify these cuts when so many patients are in need?
Well, Mr. Speaker, as this legislature knows, not only am I a physician, but I have nothing but the greatest respect for the doctors that practice in this province. They are the best in Canada, and they are among the best in terms of compensation in Canada, as well as they should be. But what I think disturbs me a little bit is the OMA has characterized this about the provision of health services to Ontarians, that somehow we're cutting services that are available to Ontarians. And nothing could be further from the truth, Mr. Speaker. In fact, these negotiations have only been about one thing. They've been about compensation to physicians, compensation that over the past 10 years, roughly, we've seen an increase in physician compensation from the government of roughly 70%. So we're asking our physicians to take a pause in that. We've had to make a modest reduction to the compensation that they receive, but it enables us to continue to fund and indeed expand our funding to areas like home care, our personal support workers, and others.